quiz. As we know, peripartum hemorrhage is one of the significant cause of maternal mortality worldwide. So research evidence suggests that hemostatic resuscitation can improve the outcomes of bleeding in obstetric patient. So hemostatic resuscitation here means we resuscitate the patient with blood and blood products to achieve the hemostasis in order to stop the bleeding. So majority of massive transfusion protocols developed include administration of blood products early in the resuscitation process. Blood products here means that FFP, platelet and also cryoprecipitate. So the earlier the blood products we transfuse is better. Okay, what is massive hemorrhage? Massive hemorrhage is a loss of a total blood volume within 24 hours, which means more than 70 ml per kg for adult, or more than 50% of total blood volume lost in less than 3 hours, or bleeding more than 150 ml per minute. What is massive transfusion? Whenever a patient having a replacement of total blood volume within 24 hours, okay, or transfusion of more than 4 RBC units in 1 hour, or replacement of more than 50% of total blood volume by blood products within 3 hours. So usually whenever a patient having massive hemorrhage, so we tend to transfuse a lot of blood that lead to the patient having this massive transfusion. Okay. So what is the complications of massive transfusion? Okay, massive transfusion may cause many complications. The important complications that we concern are hypothermia, acidosis and coagulopathy. That we call this as lethal triad. Okay, when bleeding occurs, we usually try to resuscitate patient with colloid, crystalloid and also massive RBC transfusion. So this bleeding and also massive transfusion process lead to the dilution of the coagulation factor and platelet, and also lead to hypothermia and acidosis, which subsequently causing coagulopathy, further coagulopathy and further bleeding. Okay, this is like a vicious cycle. Okay, therefore our aim is to break the vicious cycle, okay, by control the hemorrhage, use best possible resuscitation products, prevent hypothermia, prevent hemodilution and treat the coagulopathy. Okay, I would like to share an article, a systemic review of massive transfusion protocol in obstetric. Okay, they said that transfusion of FFP to RBC ratio of 1 or more than 1 is a necessary condition for optimal clinical management during the massive transfusion protocol administration in the field of obstetrics. Okay, the other articles and update on the use of massive transfusion protocol in obstetric. Okay, they suggest that hemostatic resuscitation can improve the outcomes compared with traditional resuscitation. What do you mean by the traditional resuscitation? It means that we resuscitate the patient with crystalloid and packed RBC. Okay, actually if we use crystalloid and packed RBC based resuscitation only, it has been associated with coagulopathy, edema, abdominal compartment syndrome and acute kidney injury. Okay, then they suggest for administration of RBC administered at a ratio of 1 to 1 to 1 with fresh frozen plasma and platelets. Okay, the other review article about management of DIVC associated with placental abruptio and measures to improve outcomes. Okay, they said for blood transfusion, PEG RBC and FFP should be infused at a 1-to-1 ratio, the same as in trauma cases. Because if transfusion of RBC alone cannot maintain the circulating blood volume and also may lead to dilutional coagulation factor. Okay, what is massive hemorrhage protocol, MHP? Actually, in other places, this protocol, they call it as massive transfusion protocol, MTP. But for ONG HSA, we name it as massive hemorrhage protocol to differentiate from our existing MTP for trauma patient. Okay, so this MHP is an agreed algorithm designed by a team consists of obstetrician, anesthesiologists and blood bank specialists. And this MHP had been discussed and agreed by the MHP committee members and approved by our hospital director. Okay, why MHP is important? Because we want to ensure safe and rapid delivery of blood products and to shorten and ensure accurate communication between clinician and blood bank personnel and ensure optimum use of blood and blood products. How this MHP works? Okay, many studies found that optimal RBC to FFP to platelet ratio of 1 to 1 to 1 is associated with best outcome as compared to higher ratio of RBC to FFP and platelet. So actually our practice on the IVC cycle ratio 6:4:2, actually it is not the optimum ratio to achieve hemostasis. So we should follow this ratio 1 to 1 to 1. Okay, let us go through the algorithm of MHP. Okay, this is the overview of the algorithm. Okay, first we have activation process, and then it consists, massive hemorrhage protocol consists of box 1, box 2 and box 3. So we will go through each steps one by one. Okay, prerequisition for MHP activation for MHP. So the patient must have at least 2 large bore granula. Okay, and then MHP kit 1 that consists of 2 JSM forms and 2 EDTA. MHP kit 2 that consists of 1 GXM form and 1 EDTA. So these two MHP kit must be readily available in ward and OT. And then we also need a level 1 infuser to be used during the transfusion. By using this level 1 infuser, it may allow rapid blood transfusion. Okay, so we strongly discourage the practice of pressing the blood during transfusion, pressing the blood to make the blood transfuse faster, because it can cause hemolysis of the red blood cell and subsequently causing hyperkalemia, because this hyperkalemia can cause cardiac arrhythmia to the patient. So that's why we advise for level 1 infuser. Okay, the location of activation for MHP, it may be activated from labor room, OT or ONG ward. Okay, for the lab turnaround time, from the time samples received until the MHP box issued to houseman. So each MHP box turnaround time is about 20 minutes, So which means our lab need to supply the MHP box within 20 minutes from the sample received. Okay, for transfusion turnaround time, okay, is from the MHP box issued until the completion of the MHP box. Each MHP box turnaround time is 20 minutes, which means all the blood and blood products in the MHP box need to be finished within 20 minutes from the MHP box issued. So within that 20 minutes, the ONG team need to assess the patient and give feedback to our blood bank MO on call whether want to proceed for the next box or not. Okay. Okay. We go to step 1. Okay. For activation. Okay. Who should activate the MHP? So it will be decided by either ONG consultant or specialist or anesthesiologist. Okay, and the criteria for activation is bleeding 2 liter or more, or shock index 1 or more. Okay, how to calculate this shock index? Okay, it is heart rate divided by systolic blood pressure. Okay, once the specialist decide for activation, okay, the MHP coordinator, okay, which is MOONG, have to inform our MO blood bank on call for activation. So, who is the MHP coordinator? It shall be an ONG medical officer who knows the case and does not scrub in for surgery, and he or she have to communicate whether to proceed for next MHP box or not, and to call blood bank MO for deactivation or deactivation of MHP. Okay, so in the GXM form for MHP, okay, we will provide the chop MHP chop on the MHP on the form. So please ensure that the extension of the telephone number or the telephone number is written, yeah, for the specialist activated and MHP coordinator. Okay, and then don't forget to write the which MHP box 1, 2 or 3. Okay. Okay. Steps 2 for MHP runner, which is houseman. Okay. What runner should bring for box 1? Okay. For box 1, MHP runner should take the MHP kit 1 that consists of 2 GXM form and 2 sample in EDTA tube. Okay. Then you bring this form and sample, okay, to blood bank. Then we process. After process, we will supply the blood and blood products. So you need to check all the blood and blood products at blood bank counter and also before transfusion. Okay. In this MHP, runner no need to bring the blood box because the MHP, the blood box will be kept by blood bank. Okay. And then if the uh, blood box you need to bring it to OT, so please keep the blood checking at the OT airlock. So in MHP, there will be two places for blood checking. First, at the counter of blood bank, and second, exactly before transfusion. Okay, what's inside the MHP box 1? Okay, first, it will be 2 or 4 unique spec cell group specific emergency cross match. The number of the PEC cell unit depending on the number of PEC cell had been transfused before the activation. And then also in the box 1, we have 4 units FFP. Okay, why we said it depends on a number of PEG cell unit had been transfused before activation, because we want to ensure the optimum ratio of RBC and FFP, which is 1:1. Okay. So the amount of the PEG cell to be given in box 1 will be decided by blood bank MO. So we need cooperation of MHP coordinator to give accurate history and amount of blood had been transfused before the activation. Okay, I give example. If patient already transfused with 2 units of safe O in labor room, okay, so we will supply only 2 units PEG cell and 4 unit FFP during the MHP box 1. Okay, another example, if a patient already run for blood for 4 units PEG cell, okay, then we will only supply 4 units FFP during the box 1. Okay. Alright, so after the runner take the blood straight to the respective place where the patient is, okay, then the ONG team need to decide, assess and decide whether want to proceed with the next box or not. Okay, if you need to proceed, you have to inform our MO blood bank. If you don't want to proceed, still you need to inform our MO blood bank within 20 minutes. Okay, if no call we receive within 20 minutes, so we will auto stand down. Okay, the time interval starts after the box is supplied. Okay. Okay, for step 3, okay, let's say you want to proceed with box 2. So the MHP coordinator need to call our blood bank MO to inform that you need to proceed for the MHP box 2. Okay, so what runner should bring during MHP box 2? You have to take the MHP kit 2. Okay, and it is similar steps for subsequent box. Okay, so MHP kit 2 consists of 1 GXM form and 1 sample in EDTA tube. So you bring the MHP kit 2 to our blood bank, and then we process and supply the blood and blood products. So don't forget to check the blood. Okay, what inside the MHP box 2? Okay, so it will be 4 units PEG cell, 4 unit platelet, and 4 unit fresh frozen plasma. Okay, I want to emphasize again regarding MHP runner, what you need to remember, okay, use the MHP kit 1 during the MHP box 1. And then for another box, maksudnya box 2 and subsequent box, you need to use the MHP kit 2. Okay, that's all you have to remember this. Okay. So after during transfusion, okay, after you get the blood and blood products, then you have to decide back whether to proceed with the MHP box 2 or not. Okay, if no call within 20 minutes, it will be auto stand down. Okay, let's say you want to proceed with box 3, then you give a call to our blood bank MO. And then in MHP box 3, it consists of 4 unit PEG cell, 4 unit platelet, 4 unit FFP, and also 4 unit cryoprecipitate. Okay. Okay. So again, you have to assess whether want to proceed with subsequent box or not. Okay, if no call, then we will auto stand down. Okay. If you want to proceed for subsequent box, okay, after box 3, we will supply the subsequent box will with alternate box, means box 2 and box 3. It will be alternate after the box 3. Okay. Alright. After transfusion, please return all the unused blood or used blood bag, blood box and blood as soon as possible. Okay, ensure the blood chart is complete and send a copy to blood bank. Okay, I will show the blood chart. Okay, actually we can use the blood chart that already used in ONG. Okay, so please send a copy of this blood chart to us. Okay, so you fill up the blood card, upper part of the blood card, okay, and send back to us. So the lower section, this lower section that you will paste at the blood chart just now. Okay. All right. Okay, that's all for MHP, Massive Hemorrhage Protocol. So any question regarding this Massive Hemorrhage Protocol?
If you wish to
Input?
speak, I think you can unmute your microphone. You introduce yourself and ask the question.
Is there any question or if not clear, so you can clarify or ask now lah.
Ask discuss anyone there near the
Okay, ada soalan tak? Because okay macam ni, if some of you all yang cannot join this CME, so we have provide the QR code for MHP video, this MHP video, so you can access uh, to access this MHP video lah. And then also we will provide the QR code for full protocol if you want to read in detail. And also I would like to invite you all to do this MHP quiz. So this MHP quiz, we can test our understanding regarding this MHP lah. Boleh scan the QR code. Okay. Ada soalan tak sebab because nanti kita akan implement this maybe in middle of July. So next week maybe we plan for dry run first, and then in the middle of July we will do implementation lah for this MHP.